Good afternoon. I'd like to call the Board of Health meeting to order at 4:30 p.m. If everyone would please rise and join us in the Pledge of Allegiance. I pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all. Okay. Thank you. Up on our agenda first is John Vangos and Seth LaJoy for 38 Southbridge Road septic approval. Hi, you can come right up to the table and just identify who you are, please.
I'm John Vangos, the homeowner.
Okay. Oh, here's Lori.
Seth isn't here yet, I guess. Sorry.
Okay.
He's the engineer.
So from what I understand, from what I've been told, is that they're looking, or the homeowner is looking for a variance to take the setback from the line of the property to the edge of the leach field. It's from 10 feet to have it set at 6 feet. It is a small parcel location where the septic is going. So, and it can be done with a variance by the board. So if you look at, it's on the edge of the road, it's a corner lot. There really wasn't a lot of area where else they could put the leach field. So that's what they're looking for, is a variance to 6 feet from 10 feet.
I reviewed that last week.
So, any discussion? Okay, if there's none, I'll entertain a motion.
I make a motion to accept the plans, approval of the 38 Old Southbridge Road septic plans.
We just have to state with the variance.
With the variance in place for 6 feet instead of 10 feet.
Perfect.
I second that.
I have a motion and a second. Any other discussion? Seeing none, all in favor? Aye. Passes unanimously. You are all set. You got your variance. Thank you very much. Up next is 3 D'Alessandro Ave, public hearing. Douglas Denham and Paul Henry. Are either parties present? Okay. If you can come up to the table, please. Okay. So Camille, I'll let you.
Okay. So we received a housing complaint on February 28th for no heat. The occupant, Paul, was living in a garage studio apartment. He was not home for a period of time, so it was a little bit of a delay scheduling the inspection, but we were able to go out, or I was able to go out on March 24th. I just want to confirm that that's the correct date. Sorry, March 29th. When I arrived, it's a single-family home with a attached garage. The occupant had a living room or living situation set up in the single bay garage. There was no heat source, there was no smoke detectors, there was no kitchen facilities, there was no restroom facilities. And I did explain, so he was using a space heater, but even with the space heater, it was inadequate temperature. I explained to the occupant that, in order to have a unit that is considered habitable, you have to have kitchen, you have to have bathroom facilities, you have to have, the basic functions for health and safety, and that it could possibly lead to a condemnation. I did not condemn it on the spot. Upon coming back to the office, I did issue a certified letter to the homeowner with an order to correct and a copy of the inspection report. The homeowner, Douglas Denham, I did speak to him over the phone a few times, and he indicated that through the written lease that the occupant was leasing 2 bedrooms in the single-family house. It's also, the owner also lives in the house. With this new information,
Which was false.
there is, the new information would indicate that he has access to the common areas, including the bathroom and the kitchen facilities. The homeowner did install the smoke alarms, so that aspect was identified. And right now, the outstanding item is there's still no heat source for the unit.
Okay.
Did they provide a copy of the lease?
Yes, I have. I only have one copy of it, but you guys.
If we could just look
Yep,
at that.
absolutely.
I will give you a chance to speak. We're just gathering our information.
Two rooms. So the smoke detector was installed in
Yes.
the garage.
Yep, the smoke detector was installed. I did receive a photo of that install. I believe it was on April 5th.
Does that have to be hardwired?
Excuse me. Everything has to be directed through the chair.
I'm new at this.
So, no, that's okay. So, and I will give you
Thank you.
a chance,
Sorry.
absolutely. What we do first is we gather our information from her, and then we give all parties a chance.
On April 7th, I received the photo that the combination smoke CO detector was installed in the basement, or in the garage, rather.
Okay. And you said there's still no heat source. Has he said anything as to what would be going on with the heat source? Any correspondence or anything regarding that?
Not regarding the heat, no.
Okay. And what was being used for heat?
An electric space heater. At the time of the inspection, again, this was on March 29th.
Yep.
The ambient air temperature was 58.5 degrees. During the day, it has to be 68 to 78 during the heating season.
Unless you're,
Yeah.
run hot like most of us.
Okay.
Okay, so that's understandable.
Okay. Do you have any questions for Camille at this point, Ro?
No.
Do you have any additional questions?
No.
Okay. So, Mr. Henry,
Yes, ma'am.
so I'll let you, do you have any questions for what Camille has said? Or
As far as that,
responses? Or
Just smoke detector have to be hardwired?
That I would have to verify with the fire department.
That was the question.
But I'll send an email this evening.
Okay, so you filed the original complaint?
Yes.
Okay. And when she went out, you said that you only were living in this area?
Yes. He gave you the false, when I originally moved in, I moved in upstairs, supposed to be $1,700 a month for 2 rooms.
Right.
He was supposed to move out. A week into living there, he did not move out. I came home from work, he said, I'm gonna move you down here and change your rent to $1,000 a month. I've been asking him since then for a new lease for the garage. He has not written me one. I have text asking him for a new copy of the lease. I don't have keys to his house. He locks me out. I've asked him multiple times for a key and a new lease. He has not provided me with either.
Unfortunately.
I do not rent 2 rooms. I do not, that was when I originally moved in. That only lasted 1 week.
Okay. Unfortunately, the only documentation we have is the signed, be it whether it was an original or, I'm just telling you, unfortunately, that that says you were renting 2 rooms, and that was originally signed by both parties. As to what happened or anything, we don't have additional information on that at this time. So Camille, do you have any questions for Mr. Henry?
No.
And the landlord's not here.
He was notified via certified mail, and I had informed him even prior to sending out the certified letter that we were gonna be holding this public hearing.
So did you feel it necessary, or why didn't you reach out for any other, legal help at that point? If you were being sort of moved out to a garage
Well, I've been looking for somewhere else to move to. I finally just purchased a house of my own. I'm moving out next month. I originally was just looking for heat and to be treated as a regular tenant.
But since December, he asked you to.
Yeah, and then as soon as he found out I had contacted the Board of Health, he has since gave me 2 notices to evictions, one after she came and one right before you guys came. That states in his eviction letter for threatening to call the Board of Health. 30 days notice to quit for calling the Board of Health. Not for non-payment of rent, for calling you guys.
So we are not attorneys, and I know we had spoken about this previously. We are not attorneys, we cannot provide legal advice. The last page of the inspection report goes over the basic tenant rights that is required for us to issue per the housing code. And it talks about protections from retaliation for rent increase or eviction based off of calling the local Board of Health. Anything that would need to get disputed for that would have to be brought up in the court, the legal system, so
I
unfortunately.
filed a counterclaim. He has
Okay.
filed the court claim. I filed a counterclaim.
Oh, that's good. You took some steps to protect yourself.
Yep.
So he moved your items in December? Down, when did you say?
I moved in October. It was a week after I moved in. I only had lived upstairs for a week. He was supposed to vacate, and he ended up not being able to move out. I came home from work. He said, had a garage cleaned out. He said, I'm gonna move you down here. It's a studio apartment. He said, I'll drop the rent from $1,700 a month to $1,000, which he did, and he remained living upstairs.
And what did he, so when he said it was a studio apartment, what did he provide you for facilities?
He told me he was gonna put in a little bathroom with a little sink. There's like a little L-shaped area room for it. He said he was gonna put in a vanity, a little toilet, and a little bathroom. Since done nothing. I have text where he says he's gonna put in heat, the electrician's coming, I'm gonna have heat installed, never done. I have text proving all this.
There's no insulation in this garage? This
There's
is just
some
cement?
insulation, not all insulated.
Okay,
Most of it's cement floors, and it's attached to the basement. There's a door going to the basement, which is all cement, and all the cold comes in from there. So I've been asking him since October for heat. And I had space heaters, and he would go in, unplug my electricity while I was at work. I have 2 little dogs. I'd come home, they'd be shivering, freezing, and every day come on, unplug my heat. So I've been asking him to put in real heat. He has text saying they're coming. Nobody's ever came, 6 months later.
So Camille, what is your recommendation at this time with everything?
Well, I'm moving out soon.
Before I get to a recommendation, I would like to note that I also did inform the building commissioner of a potential illegal apartment. Because this is not a habitable area of a single-family house. For recommendations, I think that as long as the occupant is currently living in that space, there has to be heat provided according to the housing code.
Okay, I definitely agree with that.
And there's also a DPH guidance that kind of talks about illegal apartments and also enforcing housing code, which often, building code, housing code contradict one another.
I've sent him copies of mass laws, all the laws, many times.
So this DPH guidance does indicate that as long as someone is living there, you have to enforce the housing code, even if it is an illegal apartment. But yeah, so that's my recommendation, is to continue to enforce the housing code, that heat has to be provided for the area.
Okay,
so at this point, the owner needs to install something that's going to
Correct.
provide a
And
heat
heat.
source.
Yep, and heat, yep. And pull all the appropriate permits, which this is where it might get tricky, because if it's an illegal apartment, I don't know if the permits being pulled will get granted.
right,
Very true.
okay. Okay, so. I think, so your next step will be to reach out?
To issue to continue the order. If the owner continues to refuse, the next step would likely be requesting a temporary restraining order through the court system, restraining him from failing to provide
Okay.
the heat.
Okay. So do you I just wanna make sure, you understand why we're limited with what we can do?
Yes,
From
I
a
do.
health board
And,
perspective.
her job is to look out for the best interest of everyone and make sure that they follow what
I understand that.
they're supposed to be doing. Unfortunately, Camille can do a lot, but a lot of it does sound court-related, civil-related.
Right.
But I know Camille, she'll continue to do everything she can. And you said you're moving out in a month?
Yes, I purchased my first home, so I'll be out of there next month.
Congratulations.
Yes,
Yeah.
congratulations, and, you know,
Sounds like a better situation for you.
Much
and
better.
Maybe this just be one of those bad experiences that you just close the door on,
Yeah, that's-
unfortunately.
okay. So, yeah, if you, and keep us informed of
Yep.
what happens,
Will
and
do.
we wish you good luck.
Thank you very much.
Thank you.
Thank
Thank
you.
you for coming.
No problem.
Wow, that's a tough situation.
Okay, up next is Tobacco Control Alliance. No, hold on 1 second. Who do I have from the Tobacco Control? Okay, hi, come up and introduce yourself, please. You can have a seat at the table.
Sure. I'm Ricardo, South Dudley.
And I'm Jody Briganti.
Hi, I'll introduce, my name is Jen Canoyer, I'm the chairman. This is Lori Dusham and Roberta Johnson,
Hi, oh.
and Camille, I'm sure you.
I'm the health agent,
Okay.
Camille Griffin.
Okay, so you're gonna have to, do you want us to call up each business and walk through the business, or do you wanna talk to us first? I'm not sure.
However you want to run it.
Okay. So might as well go right into it.
Okay.
First up, I have West Main Liquors. If I could have you come up to the table, have a seat, and just identify your name.
Okay.
My name is Bharat Patel.
Thank you for coming. Okay. So, you're coming in front of us today due to a compliance check on March 6, 2022, where there was selling of tobacco product to a person under the minimum legal sales age. Okay, so I'll let you, this is all,
All new?
yeah.
Okay, yep. So on March 6th, 2022, Tobacco Control was out with the youth inspectors, and as you guys all have copies, 1:13 p.m., West Main Liquors, located at 212 West Main Street in Dudley, Massachusetts, sold to an underage youth. Product in question, you guys all have copies, correct?
Yes,
Okay.
yep.
Game cigars in the amount of $1.75, which then generated the automatic fine in the amount of $1,000, which I assume the gentleman here is here to contest.
Yeah, I already submit the check and everything.
It's already been paid?
Yeah.
Okay.
Okay. Okay, so you've already paid the fine?
Yeah, I already submit the check on the next, a couple days before, after that. When I got the notice, I already submit the check.
Okay. Okay, so
That one's done.
then you are all set, and just please be,
All right, so there is no any
that's okay.
suspension of the sales for 3 days, right? Yeah.
There is no, at this point in time, there is no suspension, but just be aware that
Yeah.
if another sale does occur to an underage youth, the next fine is $2,000, and there is an automatic permit suspension of 7 days.
Oh.
But at this time, there is no permit suspension.
All right. How long, there's gonna be?
The next time, if it happens for a second sale, is a 7-day.
I understand, but in what period? Like,
It's a 36-month period
yeah,
that
that's
these
after
stay on.
36 months, that's gonna go over, the first violation is over, right?
Yes, it's a 36-month
Yeah.
time period on that.
So in 36 months, anything's happened, then it's gonna be second violation, and then
What I
it's considered as
Yeah.
the first violation after 36 months.
Yep, then it would be a reset after that 36-month period.
Yeah.
Yep.
That's my question.
Yep, okay.
So we just want to reiterate to you to be sure that you check every ID.
Yeah, we check the ID all the time. Last 7 years we are in business. I'm in business in a long time, but
Yeah.
this is first time happen.
So
you know.
that's all we ask, is just you be, you know. Thank you very much.
Thank you.
Okay, so up next is State Line Farms. If you can come up to the table and just identify yourself. Excuse me.
Good evening. My name is Vanita Patel.
Thank you. So I'll let you go ahead.
Yep, March sixth, 2022, tobacco control was out. Youth inspector purchased Backwoods cigars, 12:46 PM from State Line Farms located at 59 Schofield Ave, Dudley, Massachusetts, in the amount of $8.49. And I assume she's here to contest the fine.
Have you paid the fine or no?
Yes, we sent the check out already after a
So
couple
that's
of
been
days.
paid? Okay. So as he explained, there's no suspension or anything at this time, but if there's another violation within 36 months, I just want to make sure I'm understanding.
If there is another, the next sale within that 36-month time period goes to a $2,000 fine and
Okay.
a 7-day automatic suspension. If there are no sales within that 36-month time frame, it's kind of a reset, and then you're starting from zero.
Okay,
Okay, I got it.
okay. So even if it was your employee or something, be very conscientious of it and make sure that your employees are, the best bet is check every ID. Doesn't
Yeah,
matter how
we've been-
old.
We've been running business for 13 years, but we just hired new employees. We did train him, but
Yeah, so
so I'm very sorry about that.
we appreciate that, and all we're asking is just, be
Because
mindful of it and retrain the employee.
Thank you so much. I appreciate it.
Thank you.
Thank you.
Is there a little typo on that with the checkoff? It says that they
I know.
asked. Was the purchaser asked for ID, and on this one it checked off yes?
And this was, yeah, so that, what that means is that when a youth goes in, sometimes the clerks will ask for identification. They'll ask the youth. And the youths kind of follow a script, very scripted as to what their responses are. Typically, they respond with their date of birth. So when we document the information, were you asked for ID? In that particular situation, they were asked for ID, but they were still sold to anyway.
Okay,
Yeah.
thank you for the clarification.
And that's all, okay, so that's all that are in front of us tonight?
Correct.
Excuse me, we're in the middle of hearing this, I'll get on to you in just a few moments, okay? Okay, I'm sorry, Camille.
Yes, so those were the only, of the 4 violations that were issued, those were the only 2 that had requested to be present at the meeting tonight. I would request that you guys just kind of introduce the program. I think this is Dudley's first experience working with the Tobacco Boards of Health Tobacco Control Alliance.
Yep,
Did I get that right?
Tobacco
Okay.
Yep.
So I know we had tried to get you out a couple times before. I understand scheduling things happen. So if you want to just introduce about the program and go over, just a little bit of the protocols for it.
Sure, so we're both here in Joan Hamlet's stead, who is
Right.
the director of the program, and Joan is very well versed in the intricacies of this program. I guess a summation of what Tobacco Control Alliance does is we go out, we do retail education to the merchants. That includes signage, answering questions relative to the flavor, the menthol ban, information about not selling to underage youth. Another facet of this program is that we go out with the youth inspectors to, see if they can be sold to or not. We also do pricing survey information, which we collect and is gathered and then entered into a database that the lobbyists use to kind of dictate pricing. That's kind of a general summation.
I do have copies of our most recent mailings, and we did, I think it was, let's see, when we were in Dudley, it was, reading my glasses, sorry. 2/12/22, we did an educational visit, and these are the 2 letters that we brought with us.
I was
And we
just gonna
had-
ask, if you come out to work with the merchants that are
Yep.
retailing the tobacco, and so you have done that?
We have done that. We've done phone calls, introducing ourselves when you first, became part of what we do. And so if you'd like these copies, I can just leave them with you.
That would be
Okay.
great.
Yes, thank you.
So how many retailers do we actually have in Dudley that sell tobacco?
Offhand, I don't know.
I would have to check with Amanda.
Yeah, Amanda would know more.
I can look
so.
it up.
Thank you.
I just have a question. So when it says the first violation, when it's checked off, I just want to clarify this for my information.
Sure. Which store are you referring to?
In any, it's just any of them, under the
Yeah.
first violation, it says a fine of $1,000. Additionally, if the violation is a sale of tobacco products to a person under the age of 21, the tobacco product sales permit shall be suspended for 3 business days pursuant to 105 CMR 40D. A separate suspension order will be attached when applicable. When would that be applicable?
Okay, so that information came to light after we had sent out the fine information.
Okay.
We weren't made aware of that. So to kind of ensure a level playing field
Right.
for all of the communities in this program, we forewent that 3-day suspension.
3-day suspension.
Okay.
just
And
did
everybody was
fine.
just issued the $1,000 fine.
Okay,
But moving
Moving
forward,
forward.
if there are any second and subsequent third sales, then that 7-day suspension will absolutely go into effect.
okay.
Yeah.
Just curious,
Yep.
you know, that's all.
Yep.
It looks like there's 10 stores.
10? Okay.
Thank you.
And just a little more information, since 2020, the Alliance has provided education to the retailers regarding the increased fines, the new tobacco laws, and that includes the new law packet, which was hand-delivered to each store. Each store signed for that. We also did mailings. We've done 2 annual in-store retail education visits with handouts, in addition to several more mailings regarding the laws and the retailer's responsibility regarding the sales and requirements. So the stores have been
Adequately educated.
adequately, and mistakes happen.
Yeah.
Yeah,
It
everybody-
does, the smaller mom and pops, it's a
But
little
I
more
mean, there's
difficult
only a
sometimes.
3-week time period between when they were educated to when they came and inspected, and almost half of our establishments
Mhm.
sold to minors.
It happens, and unfortunately, sometimes it takes a fairly severe
Yeah.
penalty, i.e. $1,000 fine, to send the message home.
So now, we have 2 businesses that have not paid us. What is our next action with them?
That is a good question. That would be, do you know the answer?
Probably Joan will call them if you'd like.
Yeah. We will reiterate that to Joan tomorrow, and I will have Joan reach out to the board tomorrow to
Just-
speak to you guys about that.
Curious.
Sure.
Because, and I know one of them in the notes, there was a violation back in 21, so that's why I'm just
But it was
concerned.
a use sale?
Yes,
Mhm.
and that particular one has been, even prior, when we were still with the Worcester,
Mhm.
back then, they were known for, so that's why I'm just curious as to what do we do now with these 2, where they haven't
Yeah.
paid? We had 2 that paid, which we appreciate, now we have 2 that haven't, so just curious what we do next.
Okay. Yep. We'll absolutely have Joan get in touch with
Okay.
you tomorrow.
That would be great.
Yep.
Thank you very much, thank
Yes.
you for
Thank you.
walking us
Coming
through
out.
it,
All right.
and I
Exactly.
Thank you, guys.
appreciate everything, thank
Have
you.
a good day.
Thank you. Camille, what do I do?
Wait till the end?
Wait, yeah. Okay, so,
This kind of talks about,
Have a good night.
thank you very much, thank you.
and these are some of the flavor stores. There's even more that we found.
That's fine.
I'm sure I can get it from, I mean, your
Just wait for Camille.
Yeah.
Thank you guys so much for coming.
So, do I take them out?
It's plastic bags up next.
Plastic bags? Yep. Okay. So, up next, number 6, plastic bag initiative. So, I just, shooting stuff at me?
Sorry.
That's okay.
Apologize.
I just want to get some information out there. Last month's meeting, we had Joseph Garagno come in front of us who wanted to implement a ban on plastic bags. We spoke with him regarding some additional ways, and that the Board of Health was not in support of banning plastic bags, nor could they enforce the ban of plastic bags. It was explained how our health agent is 10 hours a week, and there are more pressing things to be enforced rather than just a ban on plastic bags.
We tried to take a better initiative, like a different approach to get the community involved and the
Right.
businesses involved, so.
So-
Felt like that was a good first step.
Right, and that's what we had set up with him. We're going to get him in touch with some businesses. We're going to have people reach out to help him. But at this time, shortly after that meeting, within maybe a week or two at most, I was informed by the town clerk that Joe got a citizen's petition warrant article on the May town meeting for a warrant article to ban plastic bags. And on that article, it says the banning of plastic bags, which will be enforced by the Dudley Board of Health. So that is not correct. There is no way the Dudley Board of Health can enforce that. I did inform the selectmen of it. I just want to notify the public that although I do think there's an issue with trash in general, which I'll get into more on Earth Day, the board did not feel that banning plastic bags was the right way to go.
Putting mandates in place, right, to put more work on Camille, right?
I was gonna get to that if you just let me finish, please. That we did not feel banning was the right thing, and there is no way that Camille could handle the work. And there were other things that we could do to perhaps educate, entice, and so forth. So I just want it duly noted, as it was, the Webster Times did a good article of our last meeting, and Jason Blue quoted that we could not support it at this time, we could not enforce it at this time. So I just want to be sure that the town understands, it's not that we don't want to do something regarding it, it's just that we cannot do anything about it at this time. And that if this warrant article does go through, the Board of Health will not enforce anything to do with the plastic bags. We cannot and we will not at this time. So I just want to put that out there. Any other comments from either of you on that? Okay.
No, agreed.
Perfect. So then we're going to move right into Earth Day. Earth Day we had this past Saturday. We had roughly 40 people show up. It was a beautiful day. We had a good turnout. We had a lot of people helping, and the amount of trash on the side of the road is truly incredible in this town, in all towns. Not just, but in this town. And it was, your husband went around picking up stuff, so, and yours did, and I'm sure the stuff that they saw was incredible. I mean, the bags of trash, the truckloads of people coming back with stuff was, so as a board, and I'll speak for both of you, I want to truly thank everybody who came out, who helped.
Yeah.
I want to thank the highway department and setting us up and making sure we had the dumpster and going out and picking up any leftover bags that were done afterwards. I appreciate that. It was a good day. We raffled off three $20 gift cards to the ice cream farm. We had 3 winners. I know one of them have come and picked up so far. I don't know if the other 2 have yet. I haven't heard. And I thought it was
We had, 3 or 4 teams this year?
yes, 3 or 4 different teams.
Yeah,
I know
it's
St.
nice.
Anthony had a group come out. We appreciated that.
Yeah.
The Girl Scouts had a group come out. UMass had a group come out. There were some people from the NJHS that came out separately, because I know there was a little mix-up with that.
That's who it was.
But anything
Yeah.
else?
No, it was great.
day.
Yeah, it was great.
I thought so.
The weather was perfect.
Oh,
Do you know how much trash we collected this year?
I don't have that. Amanda hasn't
Felt
gotten
like
that
it was
yet.
more.
I think so, because the dumpster was
It was pretty full.
almost, it was,
Jay's got some video of that, actually.
yeah, I saw
Yeah.
that. He did
We
post,
did,
yeah.
yeah.
So that was good. It makes you feel good, so. Then up next, we have the bike rodeo. So we lead from one right into the next. The bike rodeo, it is official, will be held Saturday, June 11th from 1 to 3 p.m. at Nichols College. I want to thank Nichols for the use of their parking lots. It'll be you'll go down Healy Road, and we'll be on each side of Healy Road in 2 different parking lots. We will have signs out. We will have, the safe house, I'm hoping for. I've got to reach out to Dean. hopefully a fire truck, hoping for a police cruiser, an ambulance, possibly some other good things. We'll have, Children's Hospital.
Is coming out to provide helmets. They'll fit all the children with helmets. So the children in town, take advantage of that. You're gonna get a free helmet.
Absolutely. We'll be advertising on Facebook, in the schools, all over, as much as we can get information out. And I want to thank Sergeant Dean Poplawski, because he's the one who's kind of spearheading it all, has the whole rodeo idea and everything. And I'll be touching base with him and, making sure everything's good. He doesn't like to come to our meetings and be on TV.
Right.
So, but that's okay. We'll touch base with him. And spread the word. And if anybody knows anything about bikes and wants to help out, or if you don't know anything about bikes and wants to help out, just contact the Board of Health. Where it should be a fun day. It was a good turnout last year. It was a long day.
Yeah.
We had fun though, so.
It's
Okay.
better and better every year.
Okay.
Yeah, absolutely.
All right. So, I'll stop here for a minute, because the rest will be kind of all together, right?
Mhm.
Yep.
Okay. So, Mr. Denham, if you'd like to come up.
I apologize for my tardiness.
Yeah, you were second on the agenda, so we've already gone, but you have a seat?
I was aware of that because the gentleman that I'm here against was screaming profanities as he was leaving the building.
Okay,
Um,
so I'm gonna have Camille just briefly give a rundown of what she's discussed with us, just so that you get the same information that he did.
So I presented to the board a history of how the complaint had come in for no heat of a garage studio apartment. The inspection was conducted on Tuesday, March 29th, and the findings were of a studio-like apartment in a garage, a single-bay garage attached to a single-family house, containing of no heat, the use of a space heater. There was no kitchen or bathroom facilities, no smoke detector. Through conversations that I had had with you via telephone and email, it was learned that the occupant is renting 2 rooms, had a signed lease from back in October, indicating that he was renting 2 rooms of the single-family house, which would presume that he had access to the common areas, including the kitchen and the bathroom, which were really the driving factors for a possible deeming it unfit for human habitation. The homeowner did provide proof that he did install the smoke detectors. It was a combination smoke CO detectors. Just so you're aware, the occupant asked if it had to be hardwired, and it was something I was going to check with the fire department. I can't make that determination, so I was going to email fire department.
For bedrooms, it has to be hardwired.
I'll
It's
confirm
by
that
law.
with the fire
I've
department.
done several renovations, so yes.
And don't remember what I was saying with that. So we had discussed the fact that there was still no heat, and the use of space heaters in that area. The occupant, did indicate that he has anticipates moving out next month. However, in the meantime, there is guidance from the Department of Public Health, who the housing code is through, that indicates that even in an illegal unit or an illegal apartment, you still have to enforce the housing code as long as anybody is living there.
So I was hoping we could get it condemned because I'm going through an eviction now. There's been an ongoing dispute with this tenant since he moved in, maybe 4 days into the encounter. So I listed rooms for rent. Me being in this area and then living down in Georgia, having worked down there, I got used to the work and living with other professionals. So I had 2 rooms rented. He wanted both of them. He took the rooms, and within a few days, the place just smelled terrible. He was smoking in his room. He wasn't cleaning up after his dogs. His dogs were peeing and pooping all over the house. I work remote. The smell was awful and disgusting. I offered him all his money back. I says, this isn't gonna work out. I have all your money, but we can't do this. He wanted to stay there. We discussed the garage. I says, you can go down in the garage for now, temporary, until you figure out what you wanna do. He thought that was great. He loved it. Around January or so, his sister, who is here with him today, always managed his money. she gave him his debit card back, and that's when the drinking and drugging just got absolutely wild. So him and his sister together lied about everything on their application and fabricated a story, and Paul's been a nightmare tenant. Paul got kicked out of his sister's house because Paul threatened, and I'm not sure if he
But that's not-
physically assaulted.
Excuse me, I'm gonna stop you right there. That's not
Okay.
relevant to the Board of Health.
Okay,
That has
but
nothing.
this gentleman, the last two places that he's lived.
Excuse me,
It's assaults.
excuse me. I just explained to you that that's not relevant to the Board of Health. What is relevant to the Board of Health, we're not the courts, we're not attorneys, is,
I just wanted to tell my side of the story, that's all.
Mr. Denham, if you would please allow me to speak, I will give you ample time. I gave him ample time, I will give you ample time. But again, we do not want to concern ourselves with any other issues except what the Board of Health directly deals with. The other issues we're not concerned with. It doesn't relate to us. It's not gonna cause an impact on us one way or the other. We're concerned with the housing code strictly.
Okay.
That's what we can enforce. We can't do anything about anything else, so there's no point in going into it when it's not going to affect what we discuss.
Okay.
So basically, she can go out and do a housing inspection. So we did see a copy of the lease, which was signed by both parties, which says the 2 rooms. Okay, so when you agreed upon sending him, or going to the garage, we'll say, did he still have access to the house?
Yes, he's always had access to the house.
What was his second room that he could, the lease says he was renting
It's
2 rooms.
It's a 2-bedroom house.
Right.
So he wanted to rent both bedrooms, and both bedrooms are on the main floor of the house.
Okay,
So
so,
the attached garage, how to get into the house, is you just walk out the stairs, up the back deck and in.
I understand
It was never an
that.
issue before,
but my question is,
until I started the eviction process.
the
Because
lease.
he has some mental health and drug issues.
Okay, again, that does not concern us, okay? It's strictly what the copy of the lease that we saw said he rented 2 rooms. So if you moved, it was agreed upon to move him to the garage.
Yes.
What was the second room? Because the lease still states that he
was-
was renting a second room. That's all we're concerned with because it's public housing.
I don't have a copy of his new lease that states $1,000 for the garage. There was a paper copy that I signed that I gave him, but I didn't take a picture of it on my phone at the time, or have any backup documentation at the time, because things were going really good.
Okay, so,
Once he moved into the garage, he was on his own, and the smell, it didn't bother me.
okay, do you have questions? Sorry, do you have any questions?
Nope.
Okay, so you want us to condemn it? That's why you're here today? You want the Board of Health to condemn that?
Based on the documentation you sent me, I had spoken with Camille, and it said in the paperwork that they were pursuing the condemned thing. So I would prefer to go that route, because I can't have family at my house. Sometimes I have family that lives with me that needs help.
But do
And I
you-
can't have that with him here.
You
So
do-
I'd
just
prefer
one
to have it
question.
condemned, yes.
Do you realize that that's an illegal living space, and that you are allowing someone to live in an illegal living space?
Once he moved in, I was in a tough situation once I found it out.
It's
so-
a yes or no question?
Yes, I'm aware of
Okay,
it.
thank you.
That would be the building department.
Yeah, so that would be the building department, that would be
Answered my
beyond
question.
us.
Yeah.
They would be the one that would determine if
Any
it was.
legal unit,
Right.
correct.
So the only thing that's missing,
So,
Would
the
be
original inspection report where it's did document
Right.
possible condemnation was based on the fact that he did not have at the time of my inspection, I was informed and did not observe any access to a bathroom facility for toilet, hand washing, shower, no access to a kitchen, which requires a stove, space for a refrigerator, kitchen sink. Those are the basics for part of having a habitable unit. Those things were not observed. Those things were, again, in conversation with the occupant. He did not inform me that he had access to those items. So therefore, those were the driving factors for the possible condemnation. Once the information was informed that he is actually renting, it's a single-family house, it's all one unit, that if he has access to the common areas, that changes the whole picture.
right, because he has access to
He
the
has
bathroom,
access
he
to the
has
items that were otherwise deeming it not habitable.
Okay,
So originally, you thought one way because of lack of information from what the tenant told you.
Lack of information and observations, yes.
okay.
It makes sense.
So the condemnation is, in essence, off the table, sort of,
Yes.
yes.
Because he does have access, everything, so now
The condition deemed to endanger that still exists is the heating facility, or lack thereof.
Right.
So that is still, something that is considered a condition deemed to exist, with the fact that he is renting 2 rooms. If the second room, that is not the garage bay, has heat, then that would then be
Satisfies that.
satisfying it.
Right, and the
Correct.
only documentation we have is that he's renting 2 rooms. I understand.
I could
that-
show you text and stuff.
But that's
I
the
could-
only-
I could email that.
That's a court thing.
That's,
Yeah.
I assume that. I have ongoing litigation with, I have all the paperwork for the eviction here with me today. And yes, Camille did speak with, the roommate, and, he fabricated a story that was on March 29th, based upon Camille and I's conversation, virtual reinspection on April 7th. The only thing left to correct is a heating facility is required. So I'm scared to go down there. I've had encounters with the police several times based on issues with Paul. They've instructed me to stay away from him. I'm dealing with a lot there with his antics, the cigarette smoking. It's really bad there. That's why I'm pursuing it with the courthouse, and that's why I was hoping we could get it condemned here today and get the ball rolling.
Unfortunately, we've, I don't, I'll let, if you guys, do you wanna each, do you wanna, no?
She basically
I have a,
Yeah.
answered it. I mean, there's
At-
no
At this point,
essence for
it's,
condemnation.
the heat is the issue, but it's not a reason to condemn.
Correct,
The-
at
the-
this point in time.
At this point in time, because the condemning would be no running water, no restroom.
so I
no-
can tell you that he doesn't come upstairs at all.
But that,
That's
Yeah,
his
it's
choice,
that's,
right?
that's, you're telling us he has access
Yeah.
to the
Yeah, the
bathroom and.
agreement, when I
Whether he
rented.
chooses
it,
to
go up or not
obviously-
So
That's his
according to,
decision.
right, so with the housing code, which is all we can take care of, he has access. The only issue that is there now is the non-heat. You were able to get in there to get the smoke detectors and carbon monoxide, so should be able to get someone in there to take care of the heating, and that,
Yes, and if it is anything that would require any sort of permitting, that requires a licensed professional, then obviously that licensed professional will be the one to install it.
right,
I've, often tell homeowners if they're, indicating that they personally cannot go in, it doesn't have to be them, it can be a handyman if it's something minor that doesn't require permit pulling, otherwise it would be a licensed professional to be
Right.
going in to do the actual work.
okay.
And what is, that's the order of correct for heating, what's the, it said 1 day to correct, we're past that now, so what's the repercussion on that?
So the next step would be, I would be possibly pursuing a temporary restraining order through the court system against you for refusing to provide heating facilities.
Okay, so I can get that installed within 24 hours of giving him notice that it's getting installed.
Yeah, so notice we definitely want notice to be provided.
I was curious how all this worked. His sister was with him today. I can show you texts, how she was verbally threatening me about suing, because she worked at a law office, so
Again, that doesn't,
interesting that-
we're just, and we explained the same
it's
thing to him.
interesting they're hearing of, how, Camille, could you tell me what the penalty would be again for that? If I failed to do that, it would be,
A temporary restraining order through the court system.
that would get me out of my house, and then he would have the house, correct?
No, that would be a restraining order for if an owner is refusing to perform or to a specific violation, they're refusing to comply with that. A temporary restraining order is restraining you from refusing to do that. So it is a court order saying that you have to then install the heating facility.
Understood. Okay. All right, I think you guys answered all my questions. Again, I apologize for interrupting my tardiness. It's just been a very stressful encounter since about, January, February. I reached out to different members of his family, and they don't want to deal with him. So I'm just doing what I can.
And we would just advise to you that if you decide to rent, make sure that you have a legal renting space in the future, that's all. That's what the
Yeah,
Board of Health would say, and make sure you follow all the public health, which I'm sure you provided him with documentation. Be sure that you follow that, so that,
It certainly was when he took the place, and
Yep.
he was down there, he was fine, and then once the cops started getting called and stuff, that's when, All right, thank you all for your time.
thank you very much, have a good day. So we're gonna take number 10 out of order. We're gonna approve our minutes so that then we can turn everything over to Camille and everyone.
I wasn't here, can I do
Oh,
that?
no.
I make a motion to approve the meeting minutes from March 15th, 2022.
I'll second that. Hearing no further discussion. A motion and a second. All in favor?
Aye.
Aye. And Roberta will abstain because she was not here.
She's not here.
But we're glad you're here now.
Yes.
Okay. So, let me just, so up next, we're just gonna lump it all together.
Sure. So I know first we have the public health nursing report and comments. I would like to conference call in Brianna Berman, who is
Okay.
our regional epidemiologist.
Do you wanna call her on the big speaker?
Absolutely.
Okay.
Call her on the big speaker.
Do I have to press any special numbers beforehand?
I don't think so.
No.
Okay, I'll give it a shot.
No, you don't. I had to think, it's been a
I
while.
think you have to do 9.
No.
Hello?
A way to turn the speaker up? Volume?
And then it should die.
Conference? Nope. Oh, that's just the volume for the ringtone. I
Okay. So hit the,
New
is,
call, there
yes.
we go. Okay.
there you go. I know, I don't do it a lot, so.
I got the phone in my bag.
Hello?
Hi, Brianna? Can you hear us?
Yes.
Okay, hello.
Yeah.
Okay, so we have you on conference call. So I first wanted to do a little quick introduction regarding our 2 regional contact trace grant funded positions. Yeah, that's a mouthful. So we have a regional epidemiologist who is Brianna Berman, who we have with us on conference call today. We also have Alyssa Price, who is our public health nurse for the region. We have, this region is built of 4 communities. It is Webster, Dudley, Oxford, and Southbridge, Webster being the host community for these 2 positions. It was the driver for this grant was because the contact tracing collaborative was ending through the state's contract back at the end of November, and COVID cases in December and January. This Department of Public Health recognized the need for additional support for local boards of health to be able to provide adequate contact tracing. Obviously, during the time that we posted the grant and were able to finally fill the positions was in January, February. Everything with COVID was changing. Contact tracing guidelines had changed as to who was getting contacted and whatnot. So we've really kind of both ladies have really rolled with the punches and done a great job. So first, I guess we'll turn it over to Alyssa to just do a quick introduction of yourself.
So I'm Alyssa. I have a bachelor's in public health. I'm also a nurse. I'm also getting my master's in public health nursing. So this is very exciting for me. I'm learning a lot. Right now with COVID, we are following up with every single case that we were getting. And doing case investigation, giving some guidance to the public. Every time we would call someone, we would say, okay, we're not gonna call your close contacts, but we're gonna give you the guidance to tell your close contacts. And just giving education, you know, we ask about vaccines, and that really helps us with numbers. And we also, Brianna did some data on the last 10 years, infectious diseases in general. And we found that hepatitis C, tick-borne illnesses, and tuberculosis were some of the main ones. So then from the data, I did some education on that in the report. So, yeah.
Right, okay, great, thank you.
Brianna, I have passed out a copy of your COVID-19 overall presentation from February 28th, 2022 to April 26th. And I will share it with the others in the room if you wanted to go
Hi.
over what you have.
Hi, Brianna.
You are a little fuzzy, so I'm sorry if can you guys hear me okay?
We
Yes,
can
we
hear
can.
you, yes.
Okay.
And
All right.
Brianna, I'll just,
Did you say?
I'll introduce so you know who you're talking to besides. My name is Jennifer Canoyer. I'm the chairman. I have Lori Dusham and Roberta Johnson here as well as board members.
Okay. Well, welcome everyone. Thank you for adding me in on the call. I'm Brianna Burnham. So I started the middle of last March. I'm the regional epidemiologist for Webster, Dudley, Southbridge, and Oxford. And I'm sorry if I'm repeating anything. It was really fuzzy. I couldn't hear much of what was being said. So I have a master's in public health. I'm currently working on my doctorate in global health. Before this, I spent 2 years doing data analysis for Peabody, working on all COVID-related stuff. And I was also a case investigator with the CTC for a period of that time. I did hear Alyssa talk about our projects. I did an infectious disease report. I do a weekly vaccine report for each town. I'm working on a really detailed COVID report. And next, we're going to look at foodborne illnesses. So, Camille, do you want me to go into the report?
Yes, please.
Okay. So, looking at the first page, we've had 62 new cases from February 28th to April 26th. 36 were breakthrough cases. 18 of them were breakthrough cases with their booster. We've had 11 cases in children under 19. No new deaths. And then completed case investigations, we had 29, which means that we actually reached those cases and completed the investigation. Looking at the next page, so 100% recovered because we had no new deaths. Mostly female, 69.4%, 30.6% were male. Looking at age and race on the next page, so you can see that about 60% were 39 and under, so a younger population is mostly at least testing right now, and I know a lot of people are testing from home, so this isn't the most accurate, but for those who are going out and getting PCRs, it's typically we're seeing the younger population, and 65% roughly are white. Looking at the next page, so there's large portions that say unknown, and that's mostly due to half the case investigations weren't completed, whether they didn't answer or we hadn't gotten to them. That's why half are unknown, but of the cases that we did complete, 4.8% had underlying illnesses, and none were hospitalized for COVID. Looking at the symptoms, we're seeing mostly cough, headache, sore throat. Only one case was asymptomatic. So that's actually a little bit different from what we were seeing prior to a few months ago. I know last year we were seeing a lot of cases that were asymptomatic, especially in vaccinated cases, but it's looking like now most people have at least 1 or 2 symptoms. And then lastly, there wasn't a lot of occupation data to pull, but you see 33% were medical professionals, which kind of makes sense if you think about who's actually going out and getting these PCR tests. Most of them have to get the PCRs, so that's why they are. Other than that, you know, the other category, just we type in the occupation, so that there was a bunch of different occupations for that. And yeah, that is it. Oh, next we go into the vaccine. I'm sorry. I forgot I added the vaccine one into this. So this is actually the weekly vaccine report that I do. So this was updated April 21st. So 58% of the residents in Dudley are fully vaccinated. 30% are fully vaccinated and boosted. These numbers are going up each week. And 6% are partially vaccinated, which goes down each week when more people get fully vaccinated. Looking at the next page, it shows, as you can see, it's 30 and up is the majority that is vaccinated. When you look at 20 to 29 and below, the percentages become less. So 89% of 75 plus in Dudley are fully vaccinated. 88% of the 65 to 74 group are fully vaccinated. And then if you look at down below the 5 to 11, only 27% are fully vaccinated. 12 to 15, only 51% are fully vaccinated, and so forth. So definitely the older population is more so getting the vaccine than the younger population. Going on to the next page, same thing, I just added in boosted. We definitely don't have we only have 30% fully boosted, vaccinated and boosted, so that's something to, that we should probably look into more, see what we can do about that. And then the next page, every race except for non-Hispanic white are almost fully vaccinated. Non-Hispanic white is only 48%, but that does make up most of the population in Dudley, so that does make sense. And then lastly, if we look at male-female, female is more vaccinated, and partially they're the same, but if you look at fully, 53 versus 47, and then boosted, 55 versus 45. So we are seeing more cases in females, at least who's going out and getting tested, but they are more of them are vaccinated and boosted.
Great, thank you very much.
Thank you.
Roberta, did you have anything to add for the public nursing report? No. Okay.
No,
Thank you,
I took
Brianna.
over as of what, yesterday? Yeah, then I will next time, but
Okay,
thank you, by
perfect.
the way,
Oh,
for your help,
absolutely.
much appreciated.
Thank you,
Absolutely, no
we
problem.
appreciate
Thank you.
that.
Thank you, Brianna, as well.
I'll help
Oh my gosh, yes, thank you for
It's a
everything.
huge help.
This is great, and
Information.
looking for good information moving
Yeah.
forward, and it's nice to be able to do something good.
It's like,
If anyone wants this email to any of the reports emailed to them too, just shoot me an email and I'll send you everything that I do.
Okay.
Right.
Ro, did you have?
Well, I was just looking at the vaccinated and boosted residents by age, and it's like, how many clinics did we have? And, people turned out, which, the first clinic was the first, but then the second one was better, third and the fourth. But there's still quite a huge number who are not fully vaccinated, and it's like, it makes me want to do another one, but the turnout wasn't there.
No.
So it just makes me wonder why. Is it a transportation thing? Why can't people come to town hall? Or why can't they go where they need to go to get the vaccine? It just makes me wonder. I don't know. I know it wasn't because of snow. We had one iffy day that we rescheduled,
Yeah.
but the rest of the dates,
It was beautiful weather,
yeah.
so.
So I don't know, something to brainstorm a little bit
Do you
about.
think that now that 50 and over can get their second booster, it would be helpful?
I don't know. We'll have to.
I don't know, because, we even did, we opened it up to if you need your first booster,
Yeah.
if you need your second shot, like, we were gonna do anything that we possibly could. And I think the only ones that the majority of the people that came for a second dose were the young kids. And we had some boosters, some teenage kids, but, not a lot of elderly, not a lot. And even when we reached out to Joshua Place, the director there said a lot of people already went and got it. And I was like, okay, well, where are those people who still need it?
Right.
Other than going to make house calls, which we certainly can't do. We can't
Right.
sit there for 15 minutes. It would take us days, hours, But it just makes me think, where are those people who still need it when we've offered it?
Mm-hmm.
And how do we get information out to them
Yeah.
that,
Maybe now that the mask mandates are gone and things have slowed down, maybe that will open the door for people. Maybe people are still a little bit nervous about going out. I don't know.
maybe
just-
consider having something in the warmer, nicer weather? I don't
Right.
know. I'm just,
Yeah, just talking out loud.
I do know the younger population, talking to parents are still really hesitant
Yeah.
about letting
Yes.
their kids go in. So I think that's something we really can't overcome.
Right.
That's, at this point, they're either gonna let them or they're not, and we're not gonna change their opinion on it.
No.
definitely information to think about.
Right.
Thank you very
Thank you
much.
so
We
much.
appreciate it.
Thank you.
Brianna, you're welcome to stay on, but you don't have to by any means.
All right,
Thank
Thank you.
you.
thank you.
Bye.
Okay, Camille, health agent.
Yes. So We also, for the regional grant, also have a regional health inspector. This is a separate grant than our contact tracing with Brianna and Alyssa. The regional grant, or the shared service regional grant is a little bit larger. It includes Webster, Dudley, Oxford, Southbridge, Auburn, and Brimfield. So it's the 6 communities. This is the grant that we have Lori Keefe, who is our community health coordinator, through. We had some hiring issues going on for finding a regional health inspector, but we are thrilled to welcome Douglas Mercurio, who just started yesterday. This grant is also based out of Webster. Do you want to do a quick introduction?
Sure. My name is Douglas Mercurio. My background was I was a housing inspector for the city of Worcester for about 4 years. Going-
Very nice.
Yeah, so I've seen a lot. And I am learning a lot, and we already have plans to learn even more. I'm excited for the opportunity to help all these towns, and let's clean up the place, all right?
We are so happy to have you. You have no idea.
Oh yeah, I'm very excited.
Welcome. We're so happy to have you. Excellent that you have all that housing experience.
Yeah.
You're in the right town.
Even just hearing the early hearings of the other issue with the condemnation, it's already sparked ideas and conversations I've already had in the past,
See?
a couple of years,
good.
because you've seen it a million times, and we even went on a housing call yesterday, and just dealing with the public, I've gotten a lot better at talking to the public. I used to have public anxiety when I first started the job. I'm like, I didn't know how I was going to do the job, and now it just comes second nature to be able to talk to them. Yeah.
Okay.
And I'm excited to work with everybody and to learn more.
Great, and you got a great person.
Yeah, I think that makes the job that much easier. Yeah.
We're fortunate to have her the limited hours we do, but we
Peter
are
Wright,
very
yeah.
fortunate. She puts in many more than what she should with us, I'm sure.
So, am I understand Joe is shared between the 6 towns?
This is Douglas.
Oh, I'm sorry.
That's okay.
My apologies.
That's okay.
He's shared between the 6 towns.
He is. Right now, we're still trying to work out the logistics of what that looks like. Is it one day? Is he on a 6-day rotation of when he's in each community? There are other regional grants for other regions that have filled this position, back in the fall when it was originally initially approved. From speaking with our grant coordinator, who also oversees the Blackstone Valley region, their regional inspector was going out on a set every specific day with a certain community. They've since gotten into a better flow and are able to each community is able to identify, okay, I'm gonna assign this to that person, and they've been able to make it work. So I think it's a little bit of a logistical challenge up front, but I'm confident that we will be able to, all 6 communities will definitely work together. We all also understand that if it's his designated Dudley day, but there's an emergency in Auburn, we all understand emergencies take priority. So Douglas will be shadowing with me in both Webster and Dudley during my time here. And we're getting him trained on food. We're going to be getting him trained on septic, a little bit of everything, swimming pools. So really opening him up to see, but even during our housing reinspection yesterday, I did watch him interacting with the occupant, and he definitely knows how to talk the talk. So that was good.
That's good.
You know how to
That's
talk,
part of it. Yep.
Talk your way out of a sticky situation, I already have my ServSafe certification, and so I'm already getting my feet wet a little bit with that. I have my associates from Quinn Sigmund College. I'm continuing my education at Worcester State University. So I don't know, once I hit 30, I want to keep pushing.
You're never too old.
Yeah.
I just finished my master's. So.
Yeah.
Yep. So, see? Oh, very good. Oh, we're, happy to bring you to all areas, not just our town, but everywhere. It's great.
Oh yeah, I've lived in Webster for about 8 years already, and a buddy of mine lived at Dudley for the past 5 years, so I'm kind of a little familiar with both towns. I went to Bay Path for high school, so I was familiar with Southbridge too. You
Yeah.
know.
So that's good.
Yeah, I worked in Auburn for 4 years, so
Yeah, you'll know it all.
yeah, you know,
You'll know
so
where
the
all
towns
your-
aren't. Brimfield. Yeah, believe it or not, I did the flea markets in Brimfield when I was
See?
younger. So
He's actually, has been requested by the Brimfield agent to assist on the Brimfield flea markets
would
for
think
all of
so.
their food trucks, and so that's in, I think, 2 weeks.
yeah.
I would
So-
definitely think so.
So we're excited to get him exposed to every aspect
Oh,
of
that's
local public
wonderful.
health, so.
And then we'll take him for the craft fair.
Yes.
Which isn't till November.
Oh, okay, not October.
Oh,
All
no,
right.
no, no. You got plenty of time, plenty of time. But see, we're planning on you being here that
Yeah.
long.
No,
Great, great. That's good.
Welcome, Douglas.
thank you.
Welcome.
Very
you.
excited to have him here. For health agent report, our last meeting, which was March 15th, there have been some updates. Since that time, we had Jen, Amanda, and I had the opportunity to take a tour of the Greatest Hits Cannabis Company, I think is their full name. So we were able to take a tour as part of their pre-operational inspection. Their marijuana operating permit was issued for their retail establishment for adult use. It was, a great experience. They were obviously very able to educate us on what their process is, and we got to kind of see what the future of that program or that it's going to look like. It's exciting.
It's exciting. Very, very cool.
Do they have projection, like for the grow part of it?
They will, yes, so they are working on, or in the process of doing cultivation and manufacturing. I assume it's probably a year or two away from that coming to fruition, but right now they're only operating as a dispensary
Okay.
for
I
adult
know
use.
people have been asking, so I
Yeah.
wanted to check
Yep,
on the
it's in the works, is my understanding.
Cool.
We've had, obviously, a couple of housing complaints, one of which we had a hearing for tonight. There was also an emergency condemnation that was issued for a heavy content situation that, we're hoping can get resolved well.
Yes.
We've also gotten a number of nuisance-related complaints. A lot of people have been calling us regarding unkept properties, whether it's a lot of rubbish and trash or junk-relaed items. So I've been out investigating those as well. Some orders to correct have been issued for those. Some are still pending investigation.
I noticed, the property on 197, that had the tires, that's been sold, and
Yes.
it was nice that they
Yes.
were able to dispose of those tires.
Yep.
Yeah, drove by that
I
often.
think that complaint was that over towards Thompson?
Yeah,
Okay.
yeah.
I'm not familiar with
Yeah,
like the
yeah,
route
yeah.
numbers. Okay,
Correct.
so I think I had driven past that property a few months ago, and I did observe the tires, but I drove past the other day, and it was all cleared up.
Yeah,
It's
so.
sold at public auction.
That's wonderful
yeah.
to see another business come in there, right? Because it looked like some type of trucking.
Like truck, like a like.
Yes, it's actually someone who's located on Oxford Ave purchased
Oh,
that as
good.
well, so that's good.
So they were able to dispose of those
Yep.
tires. That was a kind of a,
A huge
Issue
issue
with-
for mosquitoes as
Yes.
well, because of the water. and-
Exactly. Yep.
well, that's good. It's good to see that. all
Yes,
cleaned
speaking
up.
of, let's remind people,
Yeah.
mosquito season is coming, no standing water.
No
Please
standing.
eliminate standing water in your yard, because that will help eliminate mosquito problems, which in the fall could lead to those awful things that I don't want to talk about that we had years ago. So we're just gonna leave it at that.
Yes. I did recently, I think this morning, at least over in Webster, did receive an email about the state's mosquito control program. So I'm sure I will be designated as the primary arborvirus coordinator. Douglas is going to be our backup for presumably all 6 communities. So we'll keep an eye on any sort of alerts that the state issues out regarding communities at risk for West Nile or Tripoli. One thing I would like to add is that, especially after Earth Day, it is high tick season right now. So those who are out cleaning up trash on Earth Day should do a thorough tick check.
Yes, thank you.
You're welcome.
Yes, definitely.
I think that's all I have.
That's pretty good, that's enough, I'll take it.
Yeah.
All right, do we have any board comments? You had your chance to shine, but do you have anything else to say?
No, I'm gonna be quiet tonight.
You're all set?
Good. Thank you.
I'm good, I think I've said everything. I appreciate everybody tonight and everyone coming, and thank you, and I'm
Absolutely.
excited to have new people, and things should be good. So, going with that, I'll look for a motion.
Make a motion to adjourn.
I second that motion.
I have a motion and a second. Any other discussion? Seeing none, all in favor? Aye.
Aye.
Meeting adjourned at 5:45 PM.
Wow.
We good?